Today we will study one drug which is commonly one of the most commonest clinical condition for a practitioner is a headache. For the headache we have got many drugs like belladonna, bryonia, gelsemium, spigelia, sanguinaria, natromure, natrum carb, like that list goes many. But today this drug makes its unique presence based on only one symptom, that is something to do with nose. The drug with a severe headache which is relieved by epistaxis, congestive headache, throbbing headache, bursting headache, but everything is relieved by just bleeding. That is today's our drug is Melilotus alba. It's also called as Melilotus officinalis. Melilotus alba stands for white colored flower. Melilotus officinalis stands for yellow colored flower. All these are clubbed together under one heading called Melilotus. The drug which we are going to study today is called Melilotus alba. The word alba is becoming very famous nowadays because of Arsenicum alba, which is commonly used as a preventive medicine, you all know. We have many other drugs which also comes with the word alba. For example, bryonia alba, we have got veratrum album, we have got Arsenicum alba. So this is also Melilotus alba. Here alba stands for the white. There are two varieties of Melilotus. One is called Melilotus alba because it has got a white colored flower. We have another variety is called Melilotus officinalis because it has got yellow colored flower. There are various authors have described this drug under various titles. For example, Dr. H.C. Allen, Dr. Adolphe Lippe, in their textbooks of Metromedica, they described it as Melilotus alba. Whereas William Borick and Dr. Herring, they describe this drug under the title Melilotus officinalis. Whereas our Clark Dictionary and Dr. T.F. Allen, they described under the heading Melilotus. Whether it's Melilotus alba, Melilotus officinalis or Melilotus, it's almost same. The symptomatology doesn't have much difference, only the title difference, and the provings almost same. Now common names for Melilotus alba called as a sweet clover. It's also called as honey clover. Here both the places sweet honey because the flower is so sweet and honey bees are getting attracted to this flower. This drug belongs to the family called Leguminosae. We have got many drugs belongs to the family Leguminosae. Our famous Baptisia tinctora, Physostigma, Copoeva, which is very commonly given for urinary tract infection. We have got Dolichos, which is very commonly given for gallbladder pathology or liver pathology or itching without eruptions. We have got remedy called indigo, which is very commonly given in the management of bites and epilepsy. We have got Lathyrus sativa, which is very commonly given in the neurological problem, paralysis. We have got Robinia, which is very commonly given in the management of acidity, gastritis, headache. And we also have got Trifolium. We are not going to discuss all those drugs. As we said, there are two varieties, one is white and yellow, symptomatologically same. The sphere of action, it has got action on the symptoms very similar to belladonna, nervous system. It has got action on the blood vessels. It has got action on the GIT and it has got action on the female genital tract. Parts used to prepare the medicines, the tincture of the whole fresh plant is taken, especially during the flowering season. This drug is native of Europe and Asia. Now it is found all over the world. This is a short introduction about Melilotus alba. So remember, Melilotus alba and Melilotus officinalis both are same. Only difference in their flower. White colored flower is called Alba, and yellow colored flower is called Officinalis. This is a not a so deep acting drug. This is an acute remedy, a short acting remedy. You can see a image of this flower and plant in this video. As you all see, the flowers are white in color, so this is a Melilotus alba plant. You can see a characteristic leaves. Leaves are always combined into three. You can see everywhere three leaves. Okay. The word we have said common name sweet clover. The clover word means having trifoliate leaves. The plant which has got three leaves is called as a clover, and also the flowers are very sweet. That also stands for the clover. So here we have a trifoliate variety of leaf. That's the reason they call it as a clover. Clover, white sweet clover. This plant grows in a wasteland, and it is not required to cultivate. You can see the flower in a close-up image, and also you can see a plant in a dense place how it looks. You might have seen in the streets and the wastelands this plant grows abundantly. This is a slide where you can see both the white variety and yellow variety. White variety is called Melilotus alba, and yellow variety is called Melilotus officinalis. So both the flower pattern, everything is same, only color of the flower is different. And because of the yellow flower, this is sold out in the market for the medicine purpose, and it's also sold out as an ornamental plant in a market. In this picture you can see how the honeybees are getting attracted towards the flowers. That's the reason it's called as a sweet clover. Honeybees always will be there to collect the honey. That is the reason the common name has come. Now we will see the word by word meaning of Melilotus alba. The word meli, M-E-L-I, which derived from the Latin word that means honey. The word meli means honey. And lotus, L-O-T-O-S, which means a lotus, a flower. This plant having abundant sweetness and being very favorite to the honeybees. That is the reason it is named Melilotus. Meli means honey, lotus means a flower, which is sweet. The species name are Alba because the flower is white in color. We have another variety as we said in the earlier, officinalis. The word officinalis means which is sold in the shops because this plant and this flower has got yellow in color. A name which is used when the plants have some medicinal qualities and herbalist made the plant is available in the shops. The clover having trifoliate leaves which we already described. The legume is commonly named for its sweet smell which is due to the presence of a substance called coumarin, C-O-U-M-E-R-I-N, in the tissues. Coumarin, though responsible for the sweet smell of hay and newly mowed grass, has a bitter taste. The leaves are very bitter, but the flowers are very sweet. And as such, possibly act as means for the plant to discourage consumption by the animals. You can see the flowers are very sweet and the leaves are bitter. So only honey can get attracted towards this plant because of the sweet smell and because of the sweetness of the flower. That is about Melilotus alba and Melilotus officinalis yellow flower which is sold in the market. It's always interesting to know why the name is given to this particular drug like that. For example, Arnica montana, Aconite nephelus, Melilotus alba. Now each drug they don't simply name The name has got a meaning behind that. Once you understand the meaning, which is very easy to remember the symptomatology, as well as it is very easy to memorize for the students. Melilotus was first proved by Bowen in the year 1852. He proved, and he had a lot of symptomatology. He again proved the same medicine after 15 years. He used both the yellow and white varieties of the plant, and in symptomatology it is mentioned as a B. B stands for Bowen. Later on, Dr. H.C. Allen proved it and he published what Bowen is already proved. Dr. G. W. Bowen, after taking Melilotus alba, tincture of the dried root, had a severe headache, from which on second and third day he was almost delirious. This is what the symptomatology says about the proving about Melilotus alba. Severe headache to the extent that he was delirious. On the fourth day, blood started gushing out from his nose and he's become almost lost his consciousness. Later on, assistance was obtained and he recovered. This is what published in the journal. So you can see the provings of Dr. G. W. Bowen. He consumed the tincture of the dried root and he developed severe headache and is becoming severe bleeding from the nose and become totally unconscious. Later on he's been taken further assistant and he's been gained back to normal. This is about his first proving, which is detailed mentioned in the some journals. The first keynote indication of Melilotus alba is clinically it is highly verified in the management of headache. Headache may be of migraine headache may be of congestive headache, headache may be of sinus headache, may be of tension headache, may be of menstrual headache, whatever the may be the headache. The headache is very violent, full of congestion, full blood will be rushed from lower part of the body to the head and finally relieved by nosebleed. So violent congestive headache which is relieved by epistaxis. We have many drugs, headache relieved by epistaxis. Most commonly used remedies are bryonia, we have ferrumphos, we have magnesium sulf, we have erigeron, we have mellifolium, we have phosphorus. But bleeding amelioration is an excellent indication of Melilotus alba. Even the congestion, generally wherever the congestion of the head, which is generally relieved by hemorrhage. The second indication, there is a tendency for hemorrhage. As we said, the bleeding ameliorates, and this drug is also an important remedy for bleeding tendency. The bleeding is profuse and bright red, and every time before there is a bleeding, the face will be flushed, face will be congested, and then it will start bleeding. The bleeding is bright red. We have got many drugs for bright red bleeding. We have phosphorus, we have millifolium, we have ipecac. All this drug, even aconite, all this drug has got a bright red bleeding. Just opposite of this, we have a dark red bleeding, like carbavage, like ophidia group, lachesis, and acid groups. All this drug has got a dark red hemorrhage. The third indication, the face is always flushed. Most of the time face looks flushed, congested face. We should not forget one more drug which comes very close to this is sanguinaria, sulfur. Sanguinaria lady, whenever she is happy or whenever there is a complaint, whenever she is smiling, whenever she is happy, the face will turn pink. Sanguinaria is called as a pink lady. And our Melilotus alba, also the face is always a red, face is flushed. The fourth indication, very often this drug is neglected for this symptomatology. It is used in the management of epilepsy, especially after an head injury. Very often head injury means we are so prejudiced to give arnica, or epilepsy after head injury we are thinking of cicuta, sometimes Hellebores. When all these drugs are failed, when you have got indication where the face is flushed, face is red, and there is a tendency for bleeding, we should not forget Melilotus alba. The fifth indication, it is used in the management of infantile spasms, especially during dentition. Whenever the child is getting a dentition, child will getting spasms, child is getting rigidity. We have one more drug, Hellebores. We have drug belladonna. Sixth point, wants to stretch the knee, though it doesn't relieve the pain. So person is always stretching the knee, but pain doesn't relieve, with marked debility. The seventh key indication of Melilotus alba, that is full of engorgement of blood vessels, any body parts, whichever the organ is affected, that organ is surrounded by engorged blood vessels. Maybe headache means full of temporal arteries are dilated or carotids are dilated, or if the person is having a chest discomfort around the chest, you can see a dilated, or the external part you can see dilated arteries, blood vessels. There is an engorgement of blood vessels in any part of the organ. We have very important drug glonine, we have got sanguinaria, we have got amyl nitrosum, excellent remedy in emergency management. We have got belladonna, we have got ferrum phos and aconite. These are the other drugs. There will be engorged blood vessels along with the other complaints. The eighth point, there's a lot of histories available about the symptoms. There is a religious melancholy with intensely red face, and person behaves full of insanity. Person is so fearful, person is so anxious, person will be so suspicious, person will wants to jump out of the room, person wants to go away. All these are the feature of manifestation of religious mania. We should always differentiate stramonium, we must differentiate veratrum album, we must differentiate belladonna. All these things because of congestion. When the brain is full of blood, full of congested, there will be a maniacal behavior, there will be melancholic, there is a delirium, which is a characteristic of Melilotus alba. The ninth key point, there will be a nosebleed with throbbing of carotid, and nosebleed relieves most of the complaints. We must think of veratrum viridae also. The 10th indication, which is very similar to our alumina, which is very similar to bryonia. Again, bryonia comes in epistaxis. There is a constipation. So now it becomes a difficult task. When to give bryonia, when to give alumina. Both has got constipation, both has got epistaxis. Okay, constipation with difficult, painful constriction of the anus. Sometimes the constipation is so severe, there is no desire until there is a large accumulation, like alumina. We'll see how to differentiate bryonia, how to differentiate Melilotus at the end, but Melilotus alba also indicated for constipation. There is no desire until there is a large accumulation, like alumina. 11th indication, dull congestive headache, which is amelioration by profuse urination. The urination amelioration, we have remedies like gelsemium, we have a remedy like Silesia. We'll see about Melilotus alba. One of the most important clinical indication in our day-to-day practice is headache. It is not that we always think Melilotus alba is a first choice of remedy. There are many remedies for the headaches, as simple as aconite, belladonna, bryonia, gelsemium, naxomica, spigelia, natramur, glonine, natrum carb. The list goes so many, calibichromicum. But Melilotus alba has got its own unique feature for us to prescribe. Let's see what are those unique catching feature for Melilotus alba prescription. The type of headache which stands for Melilotus alba is more of congestion. There is a congestive headache like belladonna, like sulfur. So full of congestion, full of something related to vascular type of headache. It's also good for neuralgic type of headache or sick headache like migraine type of headache or periodical type of headache which comes on weekly or every fourth week. It's also good for nervous type of headache, and it is excellent remedy for the headaches especially before the onset of menses. So these are all the various types of headache where Melilotus alba is indicated. Regarding the location of the headache, so more of frontal or around the orbit or the temple, especially towards the right sided, so which becomes very close to our bryonia belladonna. It's also located at the neck, scalp, and finally ending at the occiput. These are the various areas of Melilotus alba headache. Now sensation, as you all know, a congestion means a kind of heaviness, full of pressure, because full blood from the lower extremities rushing to the head. So full blood from the extremities, it's coming up to the abdomen and to the chest and finally to the brain, leading to heavy feeling, like a pressure feeling, like oppressed feeling, undulating sensations. Feels as if a brain has become full. As a result, there is a blurring sensation. As a result of fullness, person feels as if he is drunken, is swaying from side to side. That type in the brain. There is a throbbing type of sensation. These are the various sensations. Before the headache, there will be a person feels lot of weakness, prostration. Before the headache, they also have that hot flushes. Before the headache, they also feel kind of feverish. Okay, we have to think of sanguinary, hot flushes. You have to think about glonine, again hot flushes. We have to think about simsifuga. All this drug has got before the headache. There's hot flushes and feverish feeling like belladonna. There's a severe congestion of the brain. As I've said, all the blood is rushed from the body to the brain. So finally, the extremities are feeling very cold, cold hand and cold feet, which is a characteristic feature of congestive headache, which is a unique feature of belladonna and Melilotus alba. Whole blood is rushed from the lower part, is rushed to the upper part. As a result, the person feels giddiness. There's a black spots before the eyes. There's a heaviness about the eyes. Wants to close the eyes tightly. These are the various symptoms as a result of overpressure. There is a full of throbbing of carotids, like sanguinaria, like glonine, as if all the blood vessels of the brain would give away and cause some lesion in that organ, like that feeling, as if whole blood has rushed to the brain and leading to kind of hemorrhage. That kind of sensation person will feel with because of this, because of over rush of blood to the brain. There is a result of there will be a frequent and profuse urination, which is a neurological phenomena, and that ameliorates the headache with retching and vomiting, with a sense of pressure feeling, and better by urination, which is again you see in many drugs like silicea, you see in drugs like gelsemium, or more of neurological and more of mind related headache. As a result of heavy rush of blood to the brain, the face becomes full of purplish, the face becomes full of congestion, as if whole blood is rushed to the brain and it has come till the nose. There will be a violent congestion of the head with heaviness, with fullness and throbbing, as if the blood would burst out through the nose, eyes, and wherever the openings are there, the person feels as if the blood is coming out from the nose or from the eyes or from the ears. That type of sensation. There will be severe neuralgia around the right side of the head and neck. The scalp feels too tight, which is very sensitive to touch. The headache comes every week. Headache comes sometime 4 weekly. Headache comes more during the winter months, and modalities are very clear: aggravation by motion, aggravation by thinking, like calcarea force, aggravation 9 a.m. to noon, amelioration by lying down, amelioration by epistaxis, amelioration by menses, which is bright red in color, and amelioration by also urination. In this regard, we have to compare bryonia, which comes very close running. Bryonia has got other features to differentiate, which we will see in the end of the class. Will differentiate many drugs. This is in short about Melilotus alba headache. Don't forget headache with whole blood rushing to the brain, headache with everything is from below to upward, and as if it is going to burst out, and only better by epistaxis. And females just before the menses they get severe headache and they feel better once the menses starts, and the person who is of neuralgic type of headache, they feel better when they start urinating. This is all about Melilotus alba headache. Melilotus alba about the mind practically is not so much used, but many times we are so prejudiced in our practice. We see the mania symptoms means we think stramonium, or delirium means we think about belladonna, or person has got some behavioral problems, we think of noxomica and ignatia. That is the state of many of the doctors. But when you study more deeper about Melilotus alba, there are many things which may help us to rethink our prescription. Person is very impatient, always fault finding, discontented, very furious, wants to run away and hide, like belladonna, Alzheimer's, all these things, drugs during the time of delirium, they wants to feel like running away from the place and wants to hide. Person is very indolent, unable to fix the mind. Person is very stupid and does all indifferent activities. A total inability to study. Memory will not retain anything, like anacardium, like Baraita carb, like calcare carb sometimes. Person omits the word and letters while writing. There will be loss of consciousness with gushing of blood from the nose. Because we said that whole blood is rushing to the brain, person will be stuporous condition. There will be full of delusions, thinks that everyone is looking at her, like calcare carb, that person has that feeling that people are observing me, people are looking at me. Okay, like that person is very stuporous, delusions, thinks that everyone is looking at her. Because of that, person will be very shy and always blushing, and he feels that only way to get rid of all these people is wants to go home, doesn't want to go to the public because people are looking at me, and feels very shy and blushing and wants to go home. This is all of a more of delirious state of Melilotus alba mind, and full of religious melancholic, full of praying, with red face, especially in young women with religious manifestation, full of praying, and becomes very irritable, becoming very impatient. And we should always think stramonium. At the same time, we must also think Melilotus alba, also one of the differential remedy. Melilotus alba also has got a fear manifestation. They have fear of getting into a danger, fear of being arrested. This fear is to extreme that they'll become suspicious about the fear. They become very often panic and fears to talk loud, fears to go to a public. Because of that, they always wants to run away, and that because of this fear, they have a desire to kill the people. Because people are observing them, they get a sudden impulse to kill others, and they also get sudden impulse to kill himself. There is a threatens to kill those who are approaching, because a marked fear that people are coming to arrest me, people are going to attack me. So there is only way is a defense is kill them, like that impulsive behavior. So we have to think of other remedies. Person has got a sudden impulse to kill, belladonna, naxomica, stramonium, more of in schizophrenia, more of in mania. You can think this remedy. Person thinks that there is a devil in his stomach, and contradicting all her ways, this devil is contradicting. Person become very nervous, person whispers, doesn't want to talk loudly, instead of that he talks very slowly, and person has got a severe maniatic behavior, wants to escape. And this is in short about Melilotus alba mind. You can see the remedies for religious mania. So we have bold letter remedies like belladonna, which is more of inflammatory, ioscimus, lachesis, lilium tigrinum. Person is so snappish, lilium tig. Person can hardly speak a decent word, lilium tig. Lachesis is again during the menopausal elements, the person have got religious manifestation. Pulsatilla is again hysterical and religious manifestation. Stramonium is a well-known drug with very violent mania. Then we have a sulfur and veratrum. These are the drugs. You can see the second grade of remedies, which is blue remedies, Melilotus, plumbum, and we have got other small drugs. This is just taken from the complete repertory to substantiate about religious mania about Melilotus alba. Modalities of Melilotus alba. They get aggravated when approach to storm, aggravation in the rainy weather, aggravation when changeable weather, aggravation during climacteric time, aggravation from rapid walking, amelioration from bleeding, amelioration from vinegar, amelioration after profuse urination, amelioration from walking, amelioration from the change of position, amelioration in the open air. These are the modalities of Melilotus alba. According to HCLN, Melilotus alba will act for 30 days. One dose you give, the maximum duration of action of this medicine is 30 days. The action will last for 30 days. So we have to compare belladonna in relation to headache, amyl nitrosum in relation to headache, glonine and sanguinaria in congestive type of headache. In epistaxis, we have to compare bryonia, we have to compare mellifolium, we have to compare phosphorus. There is one more drug called antimonium crudum. But in antimonium crudum, the epistaxis does not necessarily relieve, whereas in Melilotus alba, the moment person bleeds, the headache will be better. Waving in the brain, we need to compare with active racemosa. About the rheumatic pains, we need to compare with Rustox. About hemoptysis, which is bright red in color, we need to compare Ipecac, Millifolium, Phosphorus. Discomfort from constipation, we have to compare opium, Sanicula, Alumina. Congested headache and nosebleed, we need to also compare Erigeron. This is about the relationship of Melilotus alba. Comparing Metrimedica is not so easy. Theoretically, we may have a lot of points, but practical differentiating one drug from another is one of the most difficult tasks. For example, we see headache. For the headache, we have got many drugs. I am not going to differentiate each and every drug, but most commonly used drug in relation to Melilotus alba, I am trying to differentiate over here. We have some remedies like belladonna, bryonia, glonine, sanguinaria, and gelsemium. I am going to cover these 5 drugs and we'll see how to differentiate. Belladonna, as we all know, belladonna is a right-sided remedy. Bryonia also right-sided remedy. Glonine, there is no such side affinity, but more of forehead or at the vertex. Sanguinaria is again a right-sided remedy. The headache starts from the right occiput, ascends upward, and finally settle over the right eye, similar to Silesia, which starts from again right side and finally settle over the right eye. Opposite of that, starts from the left side, left occiput, and finally settle over the left eye is a spigelia. Gelsemium is again which starts from the occiput, ascends upward, and finally settle over the eyes. In Gelsemium, it is not one side, it is both the side, right side as well also left side, from back to front. And that is the location-wise differentiation about Belladonna, Bryonia, Glonine, Sanguinaria, and Gelsemium. And about the onset, we'll see. Belladonna is always sudden, always a violent and sudden onset that will make in point towards the Belladonna. Whereas Bryonia, it is not sudden, it is an insidious onset. Glonine is again a violent onset. Sanguinaria, it is more of periodical, more of sick headache, periodical headache. There is no such thing, but only thing it is in sanguinaria also it is a sudden rush, congestive. Gelsemium is a gradual headache. This is how we can differentiate about the onset of headache of Belladonna, Bryonia, Glonine, Sanguinaria, and Gelsemium. Now, what is the reason for Belladonna to have headache? Belladonna mainly comes after an haircut. A Belladonna headache may be in relation to fever. Belladonna may be of an inflammatory origin, maybe meningitis. Whereas Bryonia, which is more of nervous, like most of mental causes leading to headache, maybe of suppressed anger or mortification, vexation, headache from change of weather. Headache is also because of gastric origin in Bryonia. Glonine, it is more of external causes, like headache may be exposure to sunlight, headache may be because of exposure to artificial light, gaslight. Headache also may be due to climatic age. That is about Glonine. Sanguinaria, it is more of a neuralgic type. Gelsemium is again a mind and body connection. Gelsemium is most of the time maybe due to anxiety, maybe because of sudden emotions, maybe because of exams in students, maybe because of a bad news. That's how, based on the etiologically, we can differentiate Belladonna, Glonine, Sanguinaria, and Gelsemium. Now, how is the various sensations and type of Belladonna? Most of the time, Belladonna is a throbbing, like Melilotus alba, throbbing type of headache, congestive type of headache. In Bryonia, is more of gastric, bilious, stitching, and tearing type of pain. In Glonine, as if the head is going to burst out, so severe bursting sensation that person has to keep both the hand near to the head to prevent bursting out. There's a throbbing. Person will hold the head with the hands to prevent bursting. That is the severity of Glonine. In Sanguinaria, you got that flashing light sensation, a blurring of vision, typical of migraine type of headache, typical of a neuralgic type of headache, which you can see Sanguinaria. Gelsemium is again a headache of nervous origin, a headache maybe after a flu, a headache due to some incidents that he is going to face, maybe of exams or going to meet someone and start getting headache. That is typically of Gelsemium, like Argentum nitricum. Now about the modalities of Belladonna. Aggravation by touch, jar, light, noise, and also aggravation at 3 p.m. Bryonia aggravation, slightest movement, coughing, warmth, summer is aggravation for Bryonia. Glonine is again aggravation by sunlight, aggravation hot, aggravation movement like Bryonia, aggravation also from stimulants like wine. Sanguinary is again similar to bell, bry, aggravation touch, aggravation sanguinary starts from morning, it will go till the noon and it will be better in the evening. Gelsemium is again aggravation from sun, emotions, aggravation thinking. Here the modalities almost comes similar in every drug. Amelioration of belladonna is by rest, amelioration by warm room. Whereas in bryonia, amelioration by lying on the painful side, very important modality, lying on the painful side, and also better by pressure. In glonine, amelioration by open air, and by elevating the head. Sanguinary is amelioration by sleeping in a dark room. Gelsemium is amelioration by profuse urination, like Melilotus. Gelsemium also amelioration by sweating and also amelioration by open air. Now, some more concomitants will definitely give a clue for the medicine. In belladonna, we can always expect a inflammatory concomitant. That's called, I have mentioned, bursts, burning, inflammation, redness, dryness, and swelling. Bryonia concomitant is very often they have a constipation, they have dryness, and they have intense thirst. Glonine, we have a concomitant or more of cardiac pathologies or maybe of vascular pathology, which will tell us about glonine concomitant. Sanguinaria, we have a concomitant more of gastric phenomena, more of flatulence, more of neuralgia, which will help us to differentiate. Gelsemium definitely will have a anxiety as a concomitant, and also there is a tendency for paralysis. This is how in short you can differentiate bell, bry, glonine, sanguinaria and gelsemium in relation to headache. I think I spoke so much about Melilotus alba, you may get bored and you may get headache. So I don't want to prolong, but it is always better to conclude at the end what we have studied so far. So this slide what you have in front of you is just a summary of what all things we have already gone through about Melilotus alba. The center of Melilotus alba in red color I mentioned brain, spinal cord, blood vessel and GIT, the main affection of Melilotus alba. On the left side we have common names sweet clover and honey clover. Already explained why it is called sweet clover and honey clover. And towards the right side is a right sided remedy which is very similar to bell, bryonia, sanguinaria, which is proved by Bowen in the year 1852. We should give respect to the prover. By action of this drug on the brain, spinal cord, blood vessels, there is a rush of blood, there is a congestion, the face will become flushed, and finally there will be bleeding from the nose. Very important epistaxis. And characteristic of epistaxis is bright red in color. There will be throbbing of carotids, there will be dentitional spasms, and because of the brain spinal cord affinity there is also a tendency for epilepsy after an head injury. Remember cicuta, arnica, helleborus, these are the other drugs comes for that. And towards the left side we have one box called religious melancholy and insanity. You should remember whenever there is insanity and melancholic, religious melancholy, as we have stramonium, belladonna, veratrum album, Melilotus alba also comes very close to that. There is a delusion that he wants to go home. There is also person has got impulse to kill. This is all in just a summary of Melilotus alba. This is specially for students to memorize for the exam point of view. We should have always our own shortcuts in memorizing. So we will see about Melilotus word by word. M stands for migraine, M stands for menstrual headache, M also stands for melancholia and mania. E stands for epistaxis, which ameliorates. E also stands for engorgement of blood vessels. L stands for the family called Leguminosae. I stands for infantile spasm. I stands for insanity. I also stands for impulse to kill. L stands for livid purple face. Most of the complaints before the onset, they have the face turned livid purple and congested. O stands for occiput and orbital involvement in relation to headache. T stands for throbbing of carotids. U stands for urination ameliorations, like we have many other drugs, gelsemium, silesia. S stands for sweet clover. S also stands for stool, hard, and no desire until there is a great accumulation. S also stands for sick headache. This is in short about Melilotus alba. Thank you.